I'm Kelly Murphy of Wingspan News on-air show, and today I welcome Cameron Curtis, President and CEO of the Association of Air Medical Services, an international trade association headquartered in the Washington, D.C. area that for over 40 years has represented and advocated on behalf of their members to deliver quality, safe, and effective medical care and medical transportation for every patient in need. Cameron, thanks for joining me today, and you've had a lot going on in your world, having joined AAMS as the new leader in January 2020, just before the COVID-19 crisis, and your members have supported on the front line, managing everything that's going on the ground and in the air, to all these communities they serve. What has it been like?
Well, it's certainly been drinking from a fire hose. I think to come into a new position, I think every CEO starts a new position with all of these great ideas, and you don't anticipate being hit by a once in a lifetime pandemic. And so I think the pandemic was a blessing in some ways because I was forced to really learn the industry very, very quickly. We had many of our members most of our members were transporting COVID patients, and everybody was sort of learning on the job. They're trained to transport patients no matter what, but the difference in PPE and the lack of PPE, and they've had a very, very difficult time. Add on top of that the fact that we couldn't do any of our education sessions in person. We had to shift to a virtual annual meeting. Our Leadership Institute, we had to cancel, and we did our grad school virtually, but it has been, it's been a good but very long 2 years. And then add on top of that everything that happens with the government related to the No Surprises Act. So it's been definitely a big learning curve, a fast learning curve, but also a great experience because our members are on the front lines, and all they want to do is provide quality, safe patient care and get people where they need to be to try and save lives.
How many members do you have?
So we represent about 93% of the industry. So as a trade association, our members are the air medical providers and also industry vendors who support that, our industry. So we, because the provider is our member, anybody who works for that provider is also engaged with AAMS in some way, shape, or form.
Now, you mentioned resources, and those members must look to AAMS for a lot of resources. So what kind of information and resources are you providing them, both in the education and representing them?
Yeah, so we have a very robust legislative group. So it's led by our Vice President of Public Affairs, Chris Easley, who we work very closely. We have a great public affairs committee and several task forces related to that. And so that's a big part of what we do. But beyond that, we also offer our Medical Transport Leadership Institute, which is growing future leaders in the industry. And it's very successful. It's been going on for quite some time. And so that's a great product that we offer. We also offer our Safety Management Training Academy, which is a fairly new program. We're in the process of revamping it a little bit, but really, again, focused on safety in the aviation medical transport space. And then we launched last year our Critical Care Transport Academy, which is really focused on nurses and paramedics that want to become flight crews. So we're sort of training them, taking the knowledge that they have already as nurses and paramedics and training them to be future flight crew. We're starting to focus more on research through the Medevac Foundation International, which is our charitable arm. And then the other really big thing that's really, really exciting that we launched at the end of last year is ETHOS. It's the Emergency Transport Healthcare Operations and Safety Database. And essentially what that is right now, AAMS had this AAMS database, which was essentially a snapshot of where all of the helicopters were in the United States. And it was a snapshot in time. We would produce a PDF once a year, and then the data was no longer reliable. So I learned early in my tenure, after attending a meeting where AAMS was quoted a lot, that the data, we shouldn't be using that to support the industry. So we worked really hard. We have a great group of people who helped us develop Ethos. It's an ArcGIS database. We work with ESRI, which is, they do a lot of government contracts. They work with FEMA and CDC and lots of other organizations to really create a robust database that not only shows where the helicopters are, but what type of services they're providing, what their crew makeup is. So everything from, are they carrying whole blood and doing ECMO, to are they flying with a flight physician and a nurse, or a nurse paramedic, or do they have a specialty team like a neonatal team? It's really exciting. There's a lot of opportunity for growth there. We've launched it sort of in its first iteration, but the opportunity to do further research and collect data on the industry so that we can better support our members is substantial, and really excited to see where that goes. We're talking with other associations in this trauma space to partner with them to really make it everything that it can be.
How do you recognize the leaders of medical transportation and share those best practices that you've mentioned?
So we have several awards. We have our Program of the Year award. We have a neonatal transport award. It's a team award. We have a Lifetime Achievement award, and then we also offer a Mechanic of the Year award. And so we really focus on, one, quality patient care and safety. Those are our two main areas of focus. But it's not just that. It's more about also how they impact their community and that kind of thing. So it's really exciting. I think it's a hard choice for our awards committee, because there are so many great programs out there, and everybody is doing their very best. But it's exciting to see. We got to see them in person last year when we gave our awards at our annual conference. And really, I think my favorite award is really the mechanic, because they're sort of behind the scenes, and people often don't think about, there's a whole team of people there that are making sure that aircraft is safe to fly. And so I think that's my favorite award.
Now, in addition to awarding and recognizing these leaders, you as an industry and AAMS gather together for an annual conference every year. And I know with the pandemic, you had to move from a virtual platform, but now I understand you're going to be back in person this fall. Can you tell us a little bit about your conference?
We were actually in person last year in Fort Worth. We had a lower attendance than expected, but it was a great conference last year. So in the past, it's been the Air Medical Transport Conference, and last year it was Shift AMTC. And now this year we've launched a brand new brand, Elevate Transport Medicine, and we're really, really excited. When the team got together to really think about what we wanted our annual conference to encompass, Elevate sort of kept coming up when we were talking about words that were meaningful. So Elevate clinical education, elevate engagement, elevate our other education, elevate the experience, sort of all of those things. And, our crews and our teams are working incredibly hard, and we wanted to give them an opportunity to get together and, have some peer-to-peer learning opportunities, hands-on opportunities. We have a new theater in our exhibit hall where we focus on the Medevac Foundation International and are taking care of our own program, which is really about wellness and mental health. And, I think one thing that people don't understand is this is an incredibly hard job. And one thing I didn't realize is that your brain, although the trauma isn't happening directly to you, when you experience the trauma, your brain processes that trauma as if it is happening to you. And so, there's a high rate of suicide, and there's substance abuse, and it's, some of these people are seeing things that are unimaginable to the rest of us. And so really, through taking care of our own, we're trying to provide a program that can give them tools to sort of help get through those dark times. But lots of really great things. I mean, we have, helicopters in our hall, which is always cool. Again, focusing on some hands-on experiences. We've got some cadaver labs that we're excited to do this year. We have our Sim Cup, which is a great simulation where teams compete and they come and do the finals in person at Elevate. So that's awesome. And then we have another iSimulate challenge where people who are not quite ready for the Sim Cup get to sort of participate in a team challenge behind closed doors, and they get immediate feedback on what they could have done to improve or where they did things really well. And it's more of a casual opportunity. But again, super exciting. I think everybody's excited to get back together. We saw that in Fort Worth last year, and we're really excited to see it again in Tampa, October 24th through 26th this year.
Tell me too about, you reach out to maybe that next generation of people getting involved in this industry. What are you all doing to kind of promote that as a career and as an interest for others to get involved in?
Yeah, so I think everybody, not just our industry, but healthcare in general, and obviously lots of industries are seeing workforce shortages. And so one of the things that we're launching this year is a new engagement strategy in which we're creating councils and special interest groups. And the special interest groups will really be a community for people to get together and have conversations and share best practices just in a sort of an email listserv, but like an online community opportunity. The councils are going to be, based on more substance. So creating resources for our members. We're going to launch a few early this year. One focused on workforce issues, because that's really important. Another one focused on clinical capabilities. There aren't really any basic standards on what really needs to be in the back of an aircraft in terms of clinical capabilities. And so this engagement strategy will help us focus on growing the next generation. We have a diversity, equity, and inclusion committee we released that or launched that in 2020. That's really exciting. We had a DEI panel at our annual meeting last year and a reception, and it was really great to see people get together and talk about how diversity is important to this industry and how we need to sort of embrace that and find ways to, increase diversity in lots of different ways in the medical transport industry.
What about as the organization itself? Are you looking to grow your membership? And I know you have some international members as well, not only in the helicopter, but fixed wing aircraft as well, correct?
Yes. So we actually have 3 modes of transport. So we have rotor wing, which is helicopters. That's our primary, which is the largest number of transport vehicles in our space. We have fixed wing, which are airplanes, and then we have critical care ground vehicles as well. So yes, we are a global organization, and for the last couple of years, we've been really focused here in the United States, again because of legislative issues that are ongoing. But this year, we're planning to focus on growing our international membership. There's a lot of opportunity for us here. The nice thing about, some may not say it's nice, but the healthcare space is regulated in the United States. And so to do things like carry whole blood, which is a fairly new, clinical option on the back of an aircraft, people in Europe and in Asia are starting to look at doing the same thing, and they can learn from us because we've already been through all of the US regulations. So really, again, focused on collaboration, bringing the community together, not just in the United States, but worldwide, so that we can learn from each other best practices.
What's kind of your next set of goals going forward as we get out of the pandemic?
Yeah, I think, the other thing that you like to do as a new CEO is actually get out and visit your members. And I had the opportunity right before COVID started I got to fly in a few helicopters, and I've visited a couple of our members, but to really get boots on the ground and out there visiting more of our members. In the past, we were focused on medical transport with the emphasis on transportation. And now we really are coming into our own as a healthcare association with our focus on transport medicine with the emphasis on the healthcare piece. And so really getting that word out. There was a perception that we really weren't as interested in the patient care, and that's no longer true. So our new vision is high quality transport medicine accessible to all. And that's really what we're focused on through our strategic plan and through everything we do, is ensuring that we are providing safe and quality transport medicine that is accessible to everybody, including the rural areas where they are losing access to healthcare as hospitals close because they can no longer afford to stay open.
Well, Cameron, thanks for spending time with us. It's been interesting to hear how you're taking on this new role as president and CEO. No longer new, but 2 years during the pandemic has been difficult. But we look forward to hearing more about the vision and where AAMS is going forward to really give this first very critical care to first responders. So thank you so much for your time today.
Thank you so much for having me. It's been a pleasure, Kelly.
Thank you. I'm Kelly Murphy with Wingspan News on Air. We'll see you next time.